climbing stairs every day damages your knees.
Absolutely wrong. So any knee pain or any pain, it is your body's way of telling you something is not right.
Vitamin D deficiency and footwear, both we tend to ignore. How important are they from a bone point of view?
90% of our population has vitamin D deficiency.
Which is why we ignore it.
In a day, I see at least 15 people coming to me with neck pain and back pain.
Fair, yes.
And the reason for neck pain and back pain is because of the posture.
Yeah, we're sitting in
Either
a fabulous way.
Workplace ergonomics is absolutely poor,
Yeah.
or once you go home, you're slouching on a couch. It's a quick fix, the painkiller.
Yes.
And
yes.
it's really not good because it starts affecting your kidneys without you realizing about it. Today, people undergo knee replacement surgery, and within 4 hours, they are walking.
Hey everyone, welcome back to the Good Doctors Podcast by Zynova Shalby Hospital. I'm Jagu, and today we're talking joints, including knees, hips, and all those things that crack, ache, and sometimes make life a little harder than it should be. From sports injuries to knee replacements, from myths to the latest recovery hacks, we're covering it all with Dr. Srisanat Rao, arthroplasty surgeon and India's first joint replacement degree holder. So, whether you're squatting, sprinting, or just surviving the stairs, stick around. This episode's for you. Dr. Rao, welcome to the Good Doctors Podcast, and thank you so much for doing this with us.
It's a pleasure to be here.
Now, Dr. Rao, let me, maybe I'll go age-wise. Let's see how it works. For young people, sports injuries, knee injuries, we hear so much about the term arthroscopy. What is it exactly? What does it achieve? What does it do? When is it needed?
Correct. So, arthro means a joint.
Okay.
And scope means something that has a camera and a light source.
Okay.
So, it's a percutaneous or a minimally invasive thing that we do. There are two ways when we use an arthroscope. One is either it's a diagnostic modality, when you don't know what the diagnosis is and the patient keeps complaining of some pain. Then we use something called an arthroscope to see the inside of your joint.
Okay.
So that is a diagnostic part.
Fair.
Now, some people develop a ligament injury.
Sure.
That is, you've already been diagnosed. Now you need a therapy.
Okay.
And you know that therapy is surgery.
Yeah.
That is when you use an arthroscope for surgery.
Got it. Okay. So
there
two
is
different uses, diagnosis and surgery.
Correct. Diagnostic and therapeutic.
Okay. I keep hearing the term meniscus tear. Now, I know it's knee related. Beyond that, I'm a little blind, but I keep hearing it more and more. Is this a wear and tear? Is this a sports injury thing? Can young people have it? How does it get resolved?
So meniscus is a shock absorber between your bones.
Okay.
So two bones never come in contact with each other. There is always a soft cushioning between the bones.
Sure.
So that is where the meniscus is in your knee joint.
Okay.
So sometimes during sports or because of some activity that you do, you have a fall or something, the meniscus gets injured. It gets torn. So these meniscus, it depends on where the tear is.
Okay.
There are many areas within the knee.
Okay.
If it's in the place where it can heal, it definitely heals. If it's in a place where it doesn't heal, then what we spoke about, arthroscopy,
Fair.
It plays a role in getting your knee meniscus repaired.
Okay. Can one expect a full recovery? And by that, I mean for younger people, can they go back to playing the sports that they were? And it could be at an intensive level.
So if you have a meniscus tear at a younger age, it's okay because with surgery, it does recover. Even without surgery, it does recover depending on where your tear is. If you're a little on the higher end of your age bracket, then we would probably not be operating on you to get it back to normal.
Okay.
Right? We would just let it be and let you go through a process of wear and tear and go through a bigger surgery in the future.
Fair. Now, Dr. Rao, you made an interesting point that it could recover, especially in younger people. It could not, perhaps. And that's a diagnosis that you make. But sometimes we self-diagnose these things.
Yeah.
And it'll be, okay, play through the pain. Or in other words, walk it off.
Yeah.
Is that recommended or not?
Absolutely not recommended.
Okay.
And the reason being, I've had patients coming to me even after 6 months to 1 year of a meniscus injury.
Oh.
So you've worsened the meniscus. So when you've developed the meniscus tear, initially it's a very small tear.
Okay.
And you've come to me at 6 months, 1 year playing through the pain.
Okay.
And that time the tear has worsened than it actually was.
Fair.
So your recovery is longer.
So, and they're feeling it for this entire 6 months, 1 year, but they're still choosing to do nothing about it.
Being very brave about it,
Okay.
but it's not the wisest of things to do.
I can imagine that. Now, there is the after effects of an injury, but I want to go pre that. I'm sure there's ways to protect your knees when you know you're putting it under more strain than usual. I mean, I'm not putting it under more strain than usual, but a sports person is. Are there preemptive ways to protect knees to begin with?
There are ways. If I say there are ways, there's actually only one way to do it.
Fair enough.
And that would be to, do your pre sports routine. Do your routine prior to your sports.
The warm-up.
The warm-ups.
Okay.
So your warm-up should be proper.
Okay.
It should be dedicated.
Okay.
And you should make sure that you're doing it every single day.
Yes. Oh, so every single day, whether I'm playing or not.
You're playing or not. You don't want your muscles to tone down and suddenly go into high intensity all of a sudden.
Fair.
So you want it to be a routine.
Okay.
And once you put it as a routine, your chance of injury goes down drastically.
Okay. So it's interesting. The operative word is usually warm up, but at a slightly more professional level, a higher level of sports, there's also the term cool down.
Yeah.
How important is that in the bigger scheme of things?
Very important, because you don't want your muscles to completely feel fatigued always.
Okay.
So you want to cool down before you wind up your day.
Okay.
So once you're done with your sports, you make sure that you're exercising. You make sure that you get your physio or your colleague to stretch it out for you, the muscles. Once you're done, that means you're okay.
Okay.
And if you're not doing that on a regular basis prior to your sports or post sports, then your muscles have a higher chance of getting injured, or your ligaments for that matter.
So the warm up and the cool down is basically the bread slices of the sandwich.
Absolutely, yes.
Fair. So that's on the sports side. Let me move it to more everyday issues, perhaps even increase the broad age range that we're talking about. Knee problems, hip problems. Now, some of this can simply come from fatigue.
Yeah.
But at what point am I thinking to myself, maybe this is not fatigue? What are the signs I'm looking for? Because I would prefer to avoid the signs, but that doesn't serve any good purpose.
So any knee pain or any pain, it is your body's way of telling you something is not right.
Okay.
Now, if that settles down in 2 to 3 days, then that means it's just a fatigue-related thing.
Fair.
If it's not settling down, it's been 10 days, 2 weeks, it's not settling down, it's bothering you, that's not normal.
Okay, that's fair.
That's not normal. So that means it needs to be checked.
Now, see, here's the problem with normal, not normal. We could normalize long-term pain by saying this is just old age. But it needs to be checked at any age. Is that not right?
Absolutely. It needs to be checked. We need to make sure that your meniscus is okay. We need to make sure that your muscles are okay. We need to make sure that your ACL ligaments are okay.
Okay.
There are so many things to look at.
Absolutely.
At that point. So it's never, just because you have pain when you're 50s or 60s doesn't mean that's normal.
Okay. So the first step is awareness.
It is awareness.
And then also not ignoring what is there at the back of your head in terms of this is not normal.
Yeah.
Absolutely. When it comes to women, doctor, there are complaints of late 40s, 50s. There are complaints of knee pain. Now, what is this? Is this age degeneration? Is this some issue that is more specific to women than men? What is that exactly?
At 40s, 50s, women go something called menopause.
Okay.
It's not that men don't feel the pain. They feel the pain when they are beyond 55 because men have something called andropause and that starts later.
Fair, yes.
So for women, they go through menopause between 40s to 50s and that's why they develop these aches and pains in the knees and the shoulders more commonly.
Okay.
And at 40s, 50s is when you start developing the medical comorbidities like diabetes.
Yes. Okay.
You don't develop that at an earlier age group, majority of the time, 90% of the times. So when you start developing that along with your menopause, you start noticing pain here and there, aches and pains all over your body. But those are not normal. You need to identify why you're getting that pain. And it can be treated. All pains can be treated. Nothing is permanent.
That. So, this is the whole biological process, as it were. Two other elements, vitamin D deficiency and footwear. Both we tend to ignore. How important are they from a bone point of view?
90% of our population has vitamin D deficiency.
Which is why we ignore it.
We ignore it.
Everybody has it.
मैंने vitamin D3 capsule ले लिया.
हाँ.
But you've not tested what is your deficiency level. So you do not know. So people say, I've just taken vitamin D3 from over the counter or from a pharmacist. But you do not know what your level is prior to you taking it and post you taking it.
Sure.
So if you do not know what your level is, how do you know you're adequately treated?
Fair enough. You could be taking the medication and still be low on vitamin D.
You could still be deficient.
Fair.
Because if your level is 4 or 5, the ideal is supposed to be about 30. And if you're 4 or 5, I've seen so many patients with 4 or 5, then irrespective of how long you take vitamin D3 capsule, your levels are going to still be low.
So that's interesting. It's not a rarity. 4 or 5, you're saying, is a regular feature.
It is. In our community, in our population, it is regular because we have so many people who stay at home and are not adequately exposed to sunlight.
But this adequately exposed to sunlight is what? I keep hearing different definitions. It needs to be a couple of hours. No, you just need to stand in your balcony and feel the sun for 10 minutes. Then should we do it at 6 in the morning? Should we do it at 10 in the morning? I'm confused.
Ideal recommendation is between 9 to 1 and it should be at least 15 to 20 minutes in a day.
Okay, so this is interesting. If my morning walk is at 6 o'clock or 7 o'clock, that's not the right sun.
That's not the right sun.
Okay.
The UV rays are not the right rays that you're getting.
Okay.
So considering that, you're still going to be deficient. And we have so many of our office people going before 9.
Yes.
And or going before 9, 10, and they're already in the train or they're going already in the bus.
Yes.
And they're already in office by then.
They're already dealing with artificial lighting by, say, 9 or 10.
Yes,
absolutely.
Artificial lighting by then. And by the time they leave, it's around 5:36.
Okay.
No sunlight exposure.
Yeah.
So
between 9 to 1, for how long did you say?
At least 20 minutes.
20 minutes. Okay.
20 minutes is the ideal requirement.
Okay. It's not go have your cup of tea outside 5 minutes and come back. 20 minutes, 9 to 1, 7 days a week. Fair. Valid point. It's just one needs the measurement because like you said, vitamin D, मैं capsule ले रहा हूँ.
Correct.
It might not be enough. I'm going out into the sun. I take a walk every morning, but it's not the right kind of sun. It's not enough. So it's good to have this quantitative parameter in mind. And I appreciate that.
And even regarding the footwear that you were asking.
Yes.
So there's something called degenerative flat feet.
Okay.
Over a period of time, there's something called the congenital flat feet. Congenital flat feet is by birth you have flat feet. And that's okay. But people by around 30, 35, 40 start developing a loss of the foot arch or the heel arch.
Okay.
So once you start developing that, you start developing aches and pains because of that also.
Fair.
So when they get up in the morning, it's very difficult for them to put their first foot down because they have a lot of pain over there.
Yes.
So all this needs to be sorted by using proper footwear. Again, the awareness is very poor.
So it's awareness on 2 levels. Flat-footedness is one, but also posture. So you might have the arch absolutely fine.
Yeah.
But then posture comes into play. What does one do? Just correct it actively by yourself, or at this point we now are at physiotherapy?
So posture per se for the foot, it is not really something that we...
That's more a back issue.
It is more of a back issue. Posture is more of a back issue.
Okay.
So again, we have so many of our office going public coming to me. In a day, I see at least 15 people coming to me with neck pain and back pain.
Fair. Yes.
And the reason for neck pain and back pain is because of the posture.
Yeah, we're sitting in a fabulous way.
Workplace ergonomics is absolutely poor.
Yeah.
Or once you go home, you're slouching on the couch.
Yes. I think you can accuse me of both things and I'll have no choice but to accept it. No, fair enough. But so coming back to, let's say, knees. When knee pain first starts, what is the best first step? And I'm saying knee pain, but what do I mean by knee pain? It could be a one-off situation. It could be a situation that comes and goes. I feel it once a week. I feel it twice a week. Or it could be constant. Am I waiting for constant? Or if it starts and remains constant, what am I supposed to do at this point?
If it's one-off, it's okay.
Okay.
Everyone goes through some pain here and there. But if it's something that's bothering you, that's persistent, that's actually affecting your activity of your daily living, then it needs to be looked into.
Yeah.
So it's not something that should be ignored.
Now that looking into is sometimes painkillers.
Yeah.
And we all know of enough cases where those painkillers become a daily affair because it solves the problem immediately and you don't have to worry about it. At what point should I worry about it?
It's a quick fix, the painkiller.
Yes.
And it's really not good because it starts affecting your kidneys without you realizing about it.
Yes. Okay.
So when we then get them tested, People have a high creatinine level because it's a quick fix and they've been on it for quite a while.
It started with a knee problem, ended up in the liver.
Yeah. So that's not great. So if it's a pain that's been bothering you for a while, I mean at least 10 days it's been there, you should definitely get it tested. Go to your doctor, get it tested, identify what is the cause of pain. If you identify what is the cause of pain, it can be treated very easily.
Fair enough. Like you said, there is no lack of solutions for pain. All of that can be resolved.
Correct.
Fair enough. But
there's always a cause for pain.
But there's also diagnosis.
There is a diagnosis. You treat the diagnosis, you don't treat the pain.
Fair enough.
So there are two things I tell my patients. We're not treating you for pain. We're treating the underlying cause of pain.
Correct. The treatment for pain is as simple as a painkiller. But you take that too often, that's a problem. So you're treating cause, not effect.
Correct. So even regarding this question where the foot, people have pain early in the morning.
Yes.
And then they have to go to work.
Yes.
They don't realize the cause of that foot pain could be because their arch is slowly getting worn out or because of their improper footwear.
Fair.
They just think that pain is there's something wrong over there and take a painkiller.
Yes, absolutely.
So once I take a painkiller, I'm okay for the day.
Yes.
Next day it pops up again.
I want to come back to this footwear thing. What is proper footwear?
So it needs to
like
be...
a 10,000 rupee pair of sneakers is not necessarily proper footwear. How do we medically define proper footwear? Not what we're being told at the shoe shop.
So there is a footwear for 100 rupees also.
Yes.
And there is a footwear for 10,000 rupees also.
Fair.
There are two extremes.
Yes.
So it's something that has to be comfortable for you.
Okay.
It's your foot should be giving adequate pressure all over.
Okay.
And if you have an arch that is low, then the footwear should have an arch support also.
Okay. Fair enough.
So all that needs to be identified.
And these are questions to ask before you go into how does this look on me?
Yes.
Okay. Fair. I'm going to move this over to slightly more intensity, as it were. Knee replacement surgeries. Now, surgery is a bit of a red flag for most people.
Yeah.
Then the questions arise, is it safe? Will I get 100% of my mobility back? But yet, so many people need to do it. So what are these? Let me preempt the questions that they would ask. Is it safe? Will I get my mobility back? At what age do I need to consider it?
Yeah. So what is the right age for surgery? I've had my youngest patient at 37 years go through a knee replacement surgery. I've had my eldest patient at 90 years go through a knee replacement surgery.
Okay. So we're talking quite the range here.
There is.
And now this 37-year-old, we're talking sports person, or are we talking...
So she had a knee infection in her childhood, which spoiled her knees completely.
Okay.
And so the life expectancy after knee replacement surgery is around 20-25 years.
Okay.
With the good quality implants that we have now.
Okay.
So her thing was that, it's been about 15-20 years since I've lived a pain-free life.
Okay.
I don't want to be sitting and thinking at home that I should delay my surgery.
Yeah.
I want to have a pain-free life at least for the next 20-25 years.
So the effectiveness of a knee replacement surgery is 20-25 years, after which you need to reconsider options.
And we have options to redo the surgery
also.
Okay. Right now, we have very good implants to redo the surgeries. In 20-25 years' time, we're going to get even much better implants, probably.
Okay.
So it's not about the implants anymore, because they do last quite a while.
Yes.
And patients now look forward to having a better quality of life. It's the lifestyle.
It is that. And does knee replacement get us back to 100% mobility?
People, after getting knee replacement done, I've had patients climb all the way up in Tirupati.
Whoa, okay.
Walk for 10 to 15 kilometers in the Kumbh Mela this year.
Okay, okay.
So you can be back to how you were. People do sit down, sit cross-legged.
So I wanted to come to that because there is a lot of what we absorb is sort of Western medicine dictated. But we have our own lifestyle. Sitting cross-legged, yoga poses where, you're on your haunches, or you're on your knees, things like that. Can this all be done post-surgery?
It can be done.
No issues there?
No issues. So people do get back to yoga, people do sit cross-legged, people do sit on the floor. So there's everything that can be done.
Okay.
And people do get back to even two-wheeler driving, four-wheeler driving, people swimming, cycling.
What is the recovery period we're talking about there? How soon can you get to that?
6 weeks. 6 weeks is the ideal recommended time. By
That's
6
it.
weeks, you're back to your routine.
Okay.
And if you're going to office, by 3 weeks, you're back to your office.
Wow.
Post a
Okay.
knee replacement surgery. We've had patients at 2 weeks also go to office post a knee replacement surgery.
No. If I'm getting some time off, I'll take the time off. Itna bhi jaldi nahi hai.
So it depends on what your expectations are.
Fair.
So yeah.
No, fair. So from knee, let me come to hip. Is that a more complicated process?
No, it's the same as it's another joint replacement surgery for a
Okay.
person who's doing joints every day.
Yeah.
It's a routine.
When does one decide that we need a hip replacement surgery? I could get up from this chair now and say, oh, my lower back is hurting or my joint is hurting. But I'm probably not a candidate. At what point is one a candidate?
So in India, the number of hip replacements are less compared to the number of knee replacements.
Yes.
Whereas in Australia, there is a lot of people go through primary arthritis of the hip. Now that racial difference we've attributed to Indians going into squatting position earlier.
Oh, okay. That's actually an advantage.
That is an advantage. So I've seen, being in Australia for a while, I've seen a lot of joint replacements done in Australia.
Okay.
For primary arthritis of the hip. Whereas in Indians, the chances of primary arthritis in the hip is lesser.
I understand.
But since COVID, we've had a lot of steroid-related issues causing avascular necrosis of the hip.
You'll have to explain that to me.
So avascular necrosis is where your bone undergoes a process of death because of a less blood supply.
And this is caused by...
because of
steroid medication.
Steroid medication that was used during COVID.
I see.
So because of that, we've had a lot of joint replacements for the hip of late.
Okay.
Otherwise, the number of hip replacements that happen in India are lesser compared to the number of knee replacements.
Okay. But that's because of our lifestyle, not because of a lack of knowledge.
No, not because of lack of knowledge.
So this cross-legged thing is like yoga, all of that is actually working quite to our advantage.
Yes, it is. So in India, we're blessed to be doing those things and getting away with hip problems at a younger age.
Fantastic. Now, somebody has come for a hip replacement surgery. How different is it from, say, 15 years ago? I'm picking a number. There's robotics involved, technology has evolved. How is that helping you?
So,
and the patient?
Yeah. So, it's quite amazing to think of it that way because 10, 15 years ago, people used to undergo knee replacement surgery and be on bed for the next 2 days. Today, people undergo knee replacement surgery and within 4 hours, they are walking.
Wow.
So that's quite a drastic change in the last 10, 15 years that we've had.
And what technology has allowed that to happen? How has that worked in the OT?
The skill set has changed. The awareness has changed. The knowledge has changed.
Okay.
And implants have changed. So there's been so much change in the last 10, 15 years that people are walking within 4 to 6 hours. And there are many of our patients going home the next day.
Excellent. Okay.
So many of our patients going home the next day, whether it's a hip replacement or a knee replacement surgery, they're going home the next day.
But then there's also the recovery process, right? What happens there? Is recovery now faster because knowledge is better, the technology is better? Is that helping?
So we also have the robotic technology. With the robotic technology, we are able to precisely put the implants where we want to.
I see. Okay. It's a more exact science.
It's a more exact science.
Okay.
So if you want to cut 9 mm, you know that the robot is going to cut 9 mm. Does not mean that the robot is operating.
Sure. Yeah.
So it's more about a precision or the skill level that has come into play.
Okay.
So there are many. We have computer-assisted technology. We have robotic-assisted technology. We are nearing AI-assisted technology also.
Tell me about that because AI is bandied about regularly, but it's still such a new technology. I don't know whether I want to trust AI in a surgical matter right now. Is there, what are the developments on that?
So some of our robots are slowly getting AI technology where the AI recognizes what is the gap balance that the surgeon wants in his knee replacement.
Fair.
So when you do it over a period of time, the AI has gotten aware of the next gap it has to keep for the next patient.
I see. Okay.
So it is in process.
Okay.
And we're going to see it soon.
But it's something that you all are seeing, observing, tracking right now. It's not in full-blown use. In the meantime, we're still on precision and robotics, and that's a huge helping hand as a surgeon in the operation theater.
Yes.
So let me come to post-surgery. 4 to 6 hours versus 48 hours.
Yeah.
a recovery time that is ideally better and shorter and more simpler. When it comes to that recovery part, so when we've made our peace with abhi surgery karna hai, we are also in some way saying this is now the doctor's problem. But the doctor can only do that much in terms of the surgery. In terms of rehabilitation, in terms of physiotherapy, in terms of family support, what is needed?
So once the surgery is done, we are blessed to actually have family support over here.
Yes.
Because when we go outside India, we would start realizing that people walk in by themselves for surgery.
Yeah.
They are alone in the hospital.
Yeah.
Having been through the system where I've been abroad, I've seen people just walk in by themselves, go through surgery, be by themselves at night, just the staff nurses taking care, and then go home the next day by themselves.
Wow. Yeah, so, I can't compute that. I would need someone with me.
It would take us a lot to understand that concept. Yeah. But in India, we're blessed to have a lot of family support.
Yes.
And it is very important for recovery, I would say.
Okay.
We are both pampered at that point of time because we are having family support. It makes life easier.
Yeah. Yeah. No, fair. You know, we discussed earlier about the need for sports persons at a fairly professional level, or even just regular sports person. They might not be professional, but they're active on a regular basis. There is a certain amount of warm-up, cool-down, regular maintenance that is required. Post-surgery, let's say there is what we discussed, a 6-week rehab process until you're fully up and running, you're trekking, you're doing driving, you're traveling, all of that. But isn't some of this, or does it need to be lifelong?
No. So once you've done your joint replacement surgery, we usually recommend rehabilitation for about 2 weeks' time.
Okay.
And after post 2 weeks' time, we don't recommend doing exercises on a regular basis. We just tell them you can do it probably about 2 or 3 times a week.
Okay.
That's more than adequate.
Okay.
Just focus on walking.
Fair.
The reason for doing the surgery is because you've had pain while walking.
Yes.
And we've given that to you, given it back to you saying, now you don't have pain while walking. So you can just focus on walking. That's more than adequate.
Okay, fair enough. No, it's good to know, and it's simple and it's not complicated.
So
and not
many
something...
people do ask that question. Should I go through exercises every single day for the rest of my life?
Yeah.
And that's a very tedious process to do exercise every single day of your life.
Trust me, I know.
It's not an easy thing. We don't do it regularly also. So it's just for 2 weeks. You need to strengthen your muscles, and then you can just focus on walking regularly.
Okay.
That's more than adequate.
Okay, safe and simple. Excellent.
Very simple. We keep it very simple.
Okay. Now, Dr. Rao, as we come towards the end of the episode, let me do a bit of a rapid fire with you. I want to work with what is a myth and what is the reality behind it. Are they the same or are they two different things? Let me run this with you. Knee cracking sounds always mean arthritis is starting.
No, false.
Okay.
It just means your muscles are weak. You need to strengthen your muscles. That's why you hear the click sounds.
Absolutely. Okay. So that is step one. Strengthen muscles. There are other issues that happen before you get to an arthritis level. Okay. Climbing stairs every day damages your knees.
Absolutely wrong.
Okay.
So climbing stairs does not damage your joints.
Okay.
It is more to do with you not strengthening your muscles that damages the joints.
Okay. So this is climbing up. How about climbing down? Because it's a different group of muscles.
That's also okay. That does not damage your joints.
Okay. And this is true for knee as well as back as well as hip?
Absolutely, yes.
Okay. Fantastic. Because that's a huge myth.
Yeah.
Absolutely. Joint pain is hereditary. If parents have it, then you have it.
There is a genetic component to joint pain. But it does not mean every person, every family whose parents have had a issue will have it.
Okay.
If you've taken care of your joint properly, and by properly I mean you've exercised properly, you avoid a few activities, or you don't get injured. So in this scenario, there is less likely that you would also get it.
Okay, fair enough. It's good to be aware of.
It can be avoided.
Okay, it's good to be aware of, but when you're aware, you can also choose to avoid it proactively.
Correct.
Cold weather makes arthritis worse.
There are certain forms of arthritis. There are different forms of arthritis. There's a component called inflammatory arthritis. There's a component called osteoarthritis.
Okay.
Osteoarthritis is age-related.
Okay.
Inflammatory arthritis is because of an autoimmune problem.
I see. Okay.
So if you have an autoimmune problem, then the arthritis can worsen with cold, or cold climates or cold temperatures.
Okay.
But if it's osteoarthritis, usually it doesn't worsen with cold temperatures.
Okay. And that's a diagnosis that a doctor will give me.
It's a diagnosis that the doctor will make.
Okay.
So they have waxing and waning of symptoms if you are an inflammatory arthritis patient. So
Got it.
some temperatures you'll have a higher pain threshold. Some climates you'll have a lower pain threshold.
Fair enough.
Yeah.
Wearing high heels damages the knees.
Yes, it does.
Yeah.
Yeah.
Okay.
If you do using it regularly.
So now that's what I want to come to from a duration point of view.
Yeah.
I can understand every day is a problem. How about once a week, Saturday night, going
that's okay.
out?
And even then, Saturday night with the heels, if you're dancing, then that's a problem. Without heels, if you're dancing, then that's okay.
Fair enough. Important question to wrap up with. Replacements are too expensive and are only meant for the rich.
Absolutely not. So it's meant for everyone who wants a good quality of life. You don't want to live with pain.
Okay.
And you want to be doing whatever you've always wanted to do.
Fair enough. No, I appreciate knowing that. I want advice as a final parting question for someone who's 25 years old, active sports person, 40, 50-year-old woman dealing with biological changes, menopause, 70-year-old senior citizen dealing with age-related issues. All of these are orthopedic in nature. What is the one thing that all of us can do, or 3 golden rules, I would say, that help us preempt this, slow it down, mitigate it? What could work?
So in my mind, I have 3 things that I've always told my patients.
Okay.
One thing is keep your weight under control.
Okay.
Make sure that your BMI is less than 30. Second thing that I've always spoken about is making sure that you're exercising regularly.
Okay.
And by regularly, I do not mean 7 days a week.
Okay.
4 days in a 7-day week is absolutely fine.
At what intensity?
At least for 20 minutes to 25 minutes.
Okay. Okay.
In a day. So for at least 4 days in a week, that's more than adequate.
Okay.
And the third golden rule, if you have pain, don't ignore it.
Okay.
Because that is your body's way of telling you something is not okay.
Fair. Valid point. So we're talking about doing the exercise regularly.
Yes.
Let's say 30 minutes, 4 or 5 times a week. Yes. We're talking about weight control, BMI below 30. And your third one was?
Don't ignore pain.
Don't ignore pain. Okay, perfect. I'm going to keep those in mind. Thank you very much, doctor. This has been very insightful. It's been a pleasure having you. Thank you so much for doing this with us.
Thank you. Thank you so much.
And that's a wrap on today's episode. Remember, a little ache doesn't mean you have to stop living life fully. With the right care, smart habits, and a bit of know-how, you can stay active, strong, and live life on your own terms. Huge thanks to Dr. Rao for his invaluable insights, and thank you for listening. I'm Jagu. Catch you next time for more conversations that actually matter. In the heart of Mumbai stands a name trusted by thousands. Over 1 lakh heart procedures, 200 plus years of combined experience. From diagnosis to recovery, your heart gets complete care under one roof. Because when it comes to your heart, experience isn't optional, it's everything. Zynova Shalby Hospitals. Experience you can trust, care that you deserve.